This short webinar is designed to give you a high-level overview of the no-show problem itself and make clear why so many organizations continue to struggle with this problem, and also describe for you the HEF Intelligence No-Show Reduction Solution, talk a little bit about what makes it different and how it can help your organization significantly reduce no-shows. Before we get into the slides, I just want to talk a little bit about the no-show problem itself. So this is obviously a huge problem. Most organizations are struggling with no-shows in some capacity, and it is costing healthcare organizations millions of dollars in lost revenue on an annual basis. So a study out there estimated that on average, no-shows cost organizations about $150,000 per physician per year. And not only that, the no-shows also reduce office productivity and just cause a lot of major frustrations among physicians and staff members throughout the organization. So it's a huge problem, and despite trying many different tactics and strategies, organizations continue to struggle to find ways to effectively reduce their no-show rate and be able to keep it down. So the big question is, why is that? What are they doing wrong? Why are they not able to have a larger impact on no-shows? So the first thing we need to do is really recognize that the no-show problem is a complex problem. It is a evolving problem, and it's being driven by many different factors. Really occurring amongst a constantly changing patient population. So it's a very challenging problem to address and to really get your arms around in terms of what's going on, why aren't people showing up, and figuring out what you need to do to make sure that people do start to show up. And so really with any complex problem, the key to fixing this problem starts with first understanding the problem. And a lot of organizations don't even know what their current no-show rate is. They don't know, has it been going up, has it been going down, let alone have a really good idea and have a really good picture of the problem and an understanding of what those main drivers are and reasons behind why patients aren't showing up. So the point of all this is, if you don't know why the patients aren't showing up, then you're not going to know what the appropriate actions are. What are the right actions that you need to take to improve your no-show rate? Sometimes we've seen this where we've worked with some organizations where they've had a big no-show problem. They went out and purchased some expensive communication software, reminder systems, etc., and are disappointed to find after it's been implemented that they're seeing virtually no improvement in their no-show rate. Granted, that's not always the case, but we have seen that. And so organizations, before deciding what actions they need to take to reduce their no-show rate, they need to be smarter. They need to be more sophisticated around their approach to reducing no-shows. And this really starts with gaining a better understanding of the problem so that you can take the right action. So some of the basic questions that need to be asked here is just who, what, when, where, and why. So who are your habitual no-show patients? What are some of their defining characteristics? Are they of a particular age group? Are they folks in a particular insurance category? What are their living conditions, etc.? So you need to ask those types of questions about the patients, but you also need to ask other questions, in terms of, are most of your no-shows coming from certain types of appointments? How does your no-show rates vary among physicians? Are you having no-show rates? How is your no-show rate throughout the day? Does it vary throughout the day, throughout the week, etc.? So asking all these questions is important to getting your arms around what the real, what's the full picture here. And the last one I have on there, the why, that's probably the most important question that you do need to be asking, is why aren't patients showing up for appointments? And so, some organizations will call if a patient doesn't show up and ask why, but which is good, but they oftentimes don't take it that extra step of recording that information so that you can go back and report on that and start to see some trends within your data. So these are all the types of questions that really need to get answered. So the question is, how do you go about answering these so that you can start to develop that overall picture? So in order to do that, there's really two things that are needed. One, you need a process. You need a process that takes you from where you're currently at to where you need to be in regard to no-shows. And secondly, you need a set of tools that can provide you the information and deliver that information to you in a way that is simple to understand, and it's clear, and it's actionable. So let's take a look at those two things, and let's start here with the process. So at the beginning of the process here, this is really an assessment. You want to take a look at what you're currently doing to address no-shows. Are you currently following best practices for reducing no-shows? What are the things that you sort of know today around your no-shows? And what is really just an assumption? So going through that process, doing an assessment, figuring out where you think your biggest problems are, where your biggest areas of opportunity are, that's really the starting point, the discovery process. Then from there, you go into the definition process, and that's really just defining the scope that you want to tackle. Do you want to tackle all facilities, a particular department, etc.? And then you enter the build phase. So this is gathering all of the data from your scheduling system, from your EMR system, whatever data that is going to be important for you to analyze, and bringing all that data into a centralized repository and putting together some dashboards that you're going to use a little further down the road here. Quality assurance is just making sure that all of the data that you're gathering and reporting on is accurate. And good data that you're working with. And then you enter the performing analytics. So this is using BI tools. So this is using BI tools to spot trends within your data, to identify some of the contributing factors and the biggest problem areas. Once you're able to do that, then you're able to gain some insight. Now you're able to start to see the picture. And see what's really happening there, and seeing what are those areas where you can actually make significant improvements and really impact your no-show rate. And then from there, you figure out, you determine what actions, what are the actions that you do want to implement, and then monitor that, measure that, see what impact your actions are having on no-show rate, and then continue this improve outcomes. That's continuously looking back at your analytics over time, every 3 months, 6 months, looking in there and seeing if anything is changing, and looking at the like I said, the effectiveness of the actions that you've chosen to take. So that's the process. And the second part of seeing that overall picture here that I want to talk about is the tools that need to be in place. So our tools, the HEF Intelligence no-show reduction solution, this consists of bringing all of your data into a centralized repository, like I mentioned, and then utilizing some BI tools. So you've got data visualization tools, which are used for creating particular types of analytical dashboards. So this is going to allow you to start to answer that who, what, when, where, why. Allows you to start really pinpointing those contributing factors and spotting those negative trends within your data, so you can start to develop that picture. The second component of the tools here is the predictive analytics component. And so this is a scheduling dashboard that we create that allows your front office to really look at the risk, have visibility to those high-risk patients that we talked about. So high-risk no-show patients. So they can look at the weeks ahead and see, okay, over the next 2 weeks, I can see that I've got 6 potential high-risk no-show patients. So then you can, if you choose to, you can start to make some decisions around, do you want to do some overbooking around those patients, or double booking and things like that. And And then what I have here is the third part of our solution is just the consultation. So I mentioned that full process there. So we walk you through that entire process, providing, starting up front with the discovery and seeing what your current state is, and taking you all the way through to the end of improving outcomes. So we guide you along that process. We help you make decisions around what are the appropriate actions that you need to be taking. And then we make sure that those outcomes are improved for you. So that, in a nutshell, is a high-level overview of our HEF Intelligence no-show reduction solution. If you'd like to hear more about our solution and how it can help reduce no-shows at your organization, please shoot us an email at info@healtheformatics.com or give us a call at 630-626-2079. Thank you.